Thank you very much, and good afternoon. And I'm very happy to be here, and I'm very privileged to be able to speak to you. I graduated from University of Copenhagen more than 20 years ago as a medical doctor. I earned my PhD from University of Copenhagen, and it's always been very close to me. And the only connection I have these days is being a censor at the universities, and that's also a pleasure. And I still want to go back and do another degree if I will find the time someday. Perhaps I will do it. I changed the title a little bit of my presentation, and I'm also doing a little bit different. You're probably by now loaded with information on heavy PowerPoint slides, so there will be no text. There will be some pictures accompanying my storytelling, which is basically what I'm going to expose you to. I thought that I would reflect a little bit about life science, the significance of life science, but also the pitfalls. That's why I call it the promises and pitfalls. I'm a life scientist myself. I've also dabbled in life science, and I've always been a very big supporter of life science, and I think it has great promise. But there are also buts. It's not always good, and it's not always that the promises are fulfilled. And that's sort of the, if you will, the topic of my speech. I have always been an idealist, ever since I was a young kid. And it goes back to actually the late 70s and the whole of the 1980s, for me, was being very politically active. All of you are too young to remember the 1980s, but there was a different time, Cold War. I was physically afraid of nuclear war, and there was really, it was very, very different world. And I was very politically active by then. My 1990s was very much filled with being a good doctor, being a young doctor, and my late 90s and early zeros was filled with trying to be a good scientist. Then I went back to being a good clinician. That was the next 10 years. And then after the turn of 2010, I sort of went into administration, organizational stuff, and now I'm into government work. So that's basically a somewhat untraditional career for a medical doctor. But what has driven me and is still driving me is an idealism. It's a belief in changing the world. I haven't really been disappointed in my idealism. Maybe I'm naive, but that's me with 15 years apart. This picture was taken recently in my current work as the Director General of the Health Authority, and I'm sort of always running around like a Duracell rabbit, and that's what I did 15 years ago, trying to be a young doctor, trying to save the world one patient at a time. Now I'm trying to save the world on a bigger scale, being a government bureaucrat. It takes a certain level of abstraction to see yourself being a government bureaucrat saving the world, but it actually happens. This is the phase in my life when I tried to save the world with life science. I did my PhD research in neurophysiology, but the focus was actually, my starting point was solving the problem of urinary incontinence in women. It's a terrible disease. It's full with a lot of taboo. We don't really have good treatments for a lot of these patients with urinary incontinence. I wanted to solve that problem. I wanted to solve it with life science. And back then, this is more than 15 years ago, there was a new method called transcranial magnetic stimulation, basically a big magnetic coil, and you can charge it over the motor cortex and also down the spine, and then you can measure very precisely the latencies of the nerve conduction. So basically testing the speed of nerve conduction. The theory being that a lot of these women had some nerve damage, and if we could just pinpoint it, we could also find a magical bullet to solve that. So that's what I dabbled in. The only one original finding in my research was that the nerve conduction times for these motor pathways is one of the fastest in the body. The rest of my PhD was negative findings. It was basically a finding that this method was not usable for this specific question. And I basically killed the method. My PhD is still quoted as reference of how not to do it. And I'm actually kind of proud of that because I got the negative finding published. I got my whole PhD thesis published, and it's still available there in the public domain. But it didn't have the promise. And I moved on. I moved on to surgery, I moved on to organizational stuff, and then I moved on to politics, and then I moved on to trying to save the world in a different way. But this is just to show you, and I don't regret, it's one of the most fun times I've ever had in my whole life, was doing my PhD and doing my research, but it's just to say it's not always the promises are fulfilled. These are two examples of some of the biggest breakthrough in life science in my lifetime as a doctor. And I've followed both of them closely without being involved in that research. This one, probably the biggest change, as I'm a gynecologist by background, this is the HPV virus, the papillomavirus. The discovery of the HPV virus as the causative agent of cervical cancer in women, which earned Harald Suhrhausen a Nobel Prize in 2008. It's one of the biggest breakthroughs in life science from my perspective and being a gynecologist. And the second big breakthrough was the ability to synthesize virus-like particles that mimic this virus, and which is the technology that we use in the vaccine that prevents cancer. So we now have a vaccine that potentially will enable us to eradicate cancer disease in the world that affects a lot of women, especially young women. That's a big, big breakthrough. It's a fantastic technology, and this is life science at its best. This is another promise that hasn't really shown its potential. Back when I was in medical school more than 20 years ago, we talked about stem cells. We talked about stem cell therapy as the solution of everything. This was regenerative medicine. Whatever tissue would be damaged, was it epilepsy or whatever, brain damage, you name it, problem of age and stuff, and stem cells would be the solution. A lot of energy and resources have been poured into stem cell research, basic, also clinical applications. The promise has not been fulfilled. It has not been fulfilled yet. We don't know if it really will. It hasn't really translated to the promise. And the promise is still being there. I mean, it's still being hyped as a solution to a lot of things, but we are still looking very much for. I hope it will. I hope we'll make the breakthrough, but we haven't. These are some other examples of what life science can do, of the successes and pitfalls of life science. These are two significant drugs in recent times. One is one of the biggest blockbusters in the history of medicine. The other is one of the biggest bombs in the history of medicine. And they all happened a little bit by chance. Anybody know what this is? Viagra. Viagra was developed by Pfizer as a drug for hypertension and angina, cardiac indication. It didn't work for that, but during preclinical testing, they saw that all the young men that they were testing had an erection, lasting for several days. So they changed, and of course they were treating young men who didn't have erectile dysfunction, which is the indication these days for that pill. And then of course they changed course and developed it for that indication, and it's being used worldwide. Now it's become generic and you can buy it for nothing. And it's a huge, huge market. It was one of the biggest drug launches I ever saw as a doctor, was when they launched Viagra. I was a gynecologist, and even they pushed this drug for us gynecologists. And we were saying, okay, so it's not really indicated for women. We only see female patients, so why are you pushing it at us? And they said, well, your patients have husbands. So that's just to show you how big a market they saw, and they got this big market, and it's really a fantastic invention. It's earned a lot of money for the producer, but has it also earned a lot of good for humanity? Of course, it has to a certain degree. This one is a different drug. This was developed specifically and rapidly for a very specific indications. This is Vioxx, which is a COX-2 inhibitor, cyclooxygenase, which is one of the pathways in inflammation. And this was developed to solve the problem of side effects of NSAIDs, anti-inflammatory drugs, which has a lot of side effects on the gastrointestinal tract, especially bleeding and ulcers in the stomach. It's very effective to relieve inflammation and pain. So the idea was, if you sort of went specifically in the COX-2 pathway, you would avoid the gastrointestinal side effects, and you would get the anti-inflammation, and you would get the pain relief. And that was developed specifically for that indication in a rapid process in the late 90s, looking at a potentially huge market. And it flunked totally for a lot of reasons. Because they overlooked intentionally or unintentionally the cardiovascular side effects of this new drug. So this new drug did more harm than good. And it wasn't a solution. And it wasn't an improvement. It was a step back. It cost lives, it cost health, it cost the drug producer a lot of money. On a top 10 list of the biggest recalls ever of drugs, costing the producer a lot of money, especially in the US legislation. They have these big awards of damages, and I think this is on the top 5, maybe in the top 3 list of that. So this is just to show you the promises and the pitfalls of life science. We're always looking for the magical bullet. This is a Hollywood movie from I think the 1940s or 50s, fictionalized about this idealist doctor, life scientist, Dr. Ehrlich, who conceived the concept of the magical bullet as the drug or the solution to a specific disease that would pinpoint it and only kill it. He was searching for the cure of one of the biggest infectious diseases of that time, which was syphilis. This is the real life Dr. Ehrlich, here with a gray beard and glasses, and you can also see he is a great life scientist. It was basically a lot of trial and error when he struck on compound 606. I think he probably tried 605s before hitting on 606, damaged a lot of patients in the process, and the result was Salvarsan, which was used for some time, and this is more than 100 years ago, which was used to treat syphilis. It was not a good magical bullet. It was quickly aborted. It had a lot of side effects. This is basically arsenic, and it wasn't really the solution. But it's an interesting story, and it's he coined the phrase, the magical bullet, which has sort of kept us idealists in life science ever since at work. We want to look for the magical bullet. Can we find it? And it has a great promise. We always tend to forget the person behind. Everybody forgets this person. He's the real guy who invented the compound. Japanese guy called Dr. Hata. Nobody knows what became of him. He went back to Japan, and he didn't get the fame. Dr. Ehrlich got the fame, but he's the guy that invented the Salvarsan. So, the magical bullet today, do we have it? This is one of the biggest promises. Monoclonal antibodies is certainly worth the hype, and it's certainly worth being called a magical bullet. Monoclonal antibodies has really emerged in the last 10 years, and in these years it's really, really developing rapidly. And we are seeing some results treating various cancer diseases with monoclonal antibodies that are really amazing, especially in combination. Monoclonal antibodies is you sort of inject an antigen into a mouse, you get antibody-producing cells that will not survive, but you combine them with tumor cells, you get a hybridoma, and then you basically have in a bottle, in the lab, an eternal production facility of monoclonal antibodies that you can develop for a lot of diseases, inflammatory disease, rheumatoid arthritis, inflammatory gastrointestinal diseases, the big breakthrough, and then, of course, the cancer indications. This is life science at its best. This is life science saving the world, if you will. So this is great. The problem of the black swan is often discussed, used to be discussed in scientific theory as a problem of induction. So this is basically, we see a lot of white swans, and then we induce that because all the swans that I have seen are white, All swans must be white. And then we have the conundrum of suddenly seeing a black swan that sort of destroys our whole work picture. That's the traditional black swan problem. Increasingly, in scientific theory, there's talk about a different black swan problem. This is the problem of hype, the problem of overestimating the significance of disruptions. Disruption is a modern word that everybody's talking about, disruptive this, disruptive that, and I go to some of these leadership conferences, there's always this guy talking about disruption. There's always a hype, there's always a solution that is the great promise to everything. One of the hypes some years ago, looking back 5 years, all the talk was about telemedicine. The ability sort of to patient here and doctor here, and then some technology connecting them, and everything would be solved, everything would be beautiful. This is the whole cure. And now, I mean, the promise is not really being fulfilled. We see some results of trials that are not really showing the promise, perhaps even in some telemedicine studies showing that we do more harm than good. So that was not a promise fulfilled. Another big hype these days is personalized medicine. Personalized medicine is the cure for everything. It's the cure for increasing costs of medicine. We can do targeted individual therapy. It's the cure for side effects of medicine because we'll only treat, this is the magical bullet theory again. But is that promise really being fulfilled? We don't know it yet. There's in organizational theory, you talk a lot about the garbage can situation. Garbage can is basically if you stick your hand in a garbage can, there's sticky paper, it will stick on your hand. And the garbage can theory is that solutions finds problems, not necessarily the right problems. So telemedicine was a solution for everything. And then we found the problems that we would solve with telemedicine, but not the other way around. It's a little bit the same with personalized medicine. So my point with this whole thing and the black swan thing is that we overestimate the significance of the disruption or the black swan or the personalized, and now we can sequence the whole genome, and it makes us blind to the real problems or other solutions. So this is the real problem that we didn't think about. It's not the black swan. The real problem is global heating and the white swan suddenly appearing at our bedroom window. So that was not really, I mean, so this is black, forget about the black swan and focus on a different thing that is a much, much bigger thing. So it's not to make you disillusioned, it's just to say that in life science, as in all science, you can sometimes be blind, you can sometimes focus on the hype. That's the black swan problem. Focus your energy, don't lose your idealism, but keep a broader scope on the world and the situations. So this is the hype. This is the black swan. This is the so-called Flatley law. You all know the law that every second year the speed of microprocessors will increase, or the price of microprocessors will decrease. This is the price of sequencing the genome. Basically, now you can sequence a whole human genome for nothing. Couple of $100. I mean, and it all changed with this technology, next generation sequencing. American company called Illumina, headed by this guy called Flatley, which is why this is called Flatley's law. And now you can basically sequence a genome for nothing. You can buy this machine. This machine will sequence a genome for you, more or less automatically. And you can buy this machine for, say, $40,000, $50,000. And it's everywhere now. Everywhere in the hospitals in Denmark that I walk around, it's there, and in a couple of years it's going to be at your local doctors. So this is a solution, but does it solve all the problems? That's the question. We can sequence the genome, we can get a lot of information, but will that solve our problems? Perhaps. I'm all for it. I think it has a lot of potential, but we shouldn't overestimate it. Remember about stem cell therapies. We said this about the genome sequencing back when I was in medical school, that when we would be able to do that, everything would be solved. Probably we would know everything about diseases. We still don't know a lot. So this is the promise, this is the pictures of health that we're always envisaging. with life science. This is what we want to promote. This is what we want to heal. This is what we want to achieve. But this is the reality. This is the picture of health. And this is the problem. So can life science solve this problem? Perhaps, perhaps not. Can life science solve this problem? This is a real photograph. In this day and age of photoshopped pictures, you might think that somebody had inserted the vulture looking at the little skinny, starving African child, and the vulture is waiting to eat the child. This is not photoshopped, and this is not an ancient photograph. This is a real photograph. The South African journalist that took the picture got the Pulitzer Prize or whatever prize you get, Nobel Prize for journalists or whatever, and then later he committed suicide because he had traveled around Africa seeing this stuff, and perhaps he was a little bit depressed. So can life science solve this problem? Can life science heal the world? Of course it can, and of course it can contribute, but you should also remember there are also other sciences as well. Life science is not going to solve this specific problem. Social science is perhaps going to contribute to solving this problem. Political science can probably solve this problem. But life science cannot solve the problem, but it can contribute. So can life science save the world? Yes, it can. Can it save Africa? Yes, it can. Has life science saved Africa and the world? Yes, it has. This is a picture of the most effective life science technology ever in the history of humankind. The one technology in the history of humankind that saved most lives is this. This is the immunization program for smallpox. Smallpox in Danish is kopper. Smallpox was eradicated from the face of the earth in the late 70s. And this is a picture of the immunization programs in Nigeria back in the late 60s. That was life science. That was the invention of Fleming of inoculating a child, boosting natural immunity, eradicating disease. And that was developed across the world. It was a concerted effort. It was not possible without life science. We have the same potential for cervical cancer as I was saying about HPV. We are close to having eradicated polio from the face of the earth. The WHO, the World Health Organization, is in the last stages of documenting the eradication of polio. So it's probably going to happen even in my lifetime and certainly in yours. And we could eradicate other diseases as well with life science. So I'm not going to leave you disillusioned, even though I have showed you some pitfalls of life science. I hope I can leave you with the idealism that life science can, of course, save the world. Thank you.